Assalamu alaikum everyone, all of you, welcome to this YouTube channel. A very common question, what is anxiety attack? In this video, I'm going to correct your understanding about anxiety with the help of anxiety definition, with some of the examples of anxiety in our real life, what actually anxiety disorder is, particularly what is anxiety in psychology versus anxiety meaning known by our general public. Then I would like to answer some of the common questions such as what is the cycle of avoidance or cycle of anxiety? What is stress? Fear or anxiety? Is there any difference among it? And then I would like to tell you about all the types of anxiety disorder, whereas signs, symptoms and treatment of each type of anxiety disorder would be included in my upcoming videos. So the main theme of this video is to make your understanding and general perception correct about anxiety, because it is really a pandemic nowadays. And you know what, the most frequently searched question in 2023 is what is anxiety? So viewers, let's begin with the definition of anxiety. That is a feeling of unease, nervousness or worry about a person or a place or a thing with an uncertain outcomes. The outcomes could be bad, could be good, but how would you know? You haven't experienced that. It's only a fear or a worry inside your brain for something you don't want to deal with. Now, what actually happens during anxiety attack? There are two principal components of anxiety. Number one, psychological component, which means what happens inside your brain during anxiety attack. You're gonna create tension, fears and apprehension that would result in difficulty in concentration, and with that nervousness inside your brain, your body would respond by increasing heartbeat, respirations and sweating. You're gonna feel difficulty in breathing, tremors and palpitation. This body reaction is number two component of anxiety, which is called somatic. So up till now, I hope you have a clear understanding about anxiety. Now I would like to ask you a question. What do you think? Is it normal or a disorder? Well, it's absolutely normal. It happens with everyone, not only with humans but also with animals. Every time you're gonna feel it, from a stolen car to a broken heart. It's a part of normal human behavior. So where is the problem? What actually anxiety disorder is? I'm gonna explain it with the help of simple example. You can apply that example to your case. Mr. Arslan is a college student. He is anxious about his exams just like his other class fellows. However, Mr. Arslan is more anxious because 1 month is remaining for his exams and he hasn't yet started his preparations. Now, rule number one, anxiety and work both are inversely proportional to each other. The more you work, the lesser would be anxiety. Rule number two, this anxiety and work equation is only applicable to the things where outcomes are certain. For example, to have a cup of water, you know how much effort is required to go to the kitchen and to have a cup of water. However, things where the outcomes are uncertain, you cannot predict how much effort is required to achieve it unless you experience it and predict that effort. Now let's apply both of these rules to the example of Mr. Arslan, who is very anxious about his exams. Let's just say his level of anxiety is at 10 and his preparation level, which is work, is at 0. Now let's just, for example, Mr. Arslan knows how much effort is required to pass that exam. So in this case, the outcomes are certain. Mr. Arslan knows about the outcomes. Let's just say if the outcome is at level 5, if we apply the first rule, Mr. Arslan has to work from 0 to 5 to bring his anxiety down all the way from 10 to 5 to achieve that outcome. However, in reality, we never know how much effort is required to pass the exams. So in the exam cases, we are always uncertain. Well, move to the example, Mr. Arslan don't know the level of outcome. It could be at level 6 or level 7. Now, rule number 3. The only way Mr. Arslan would be able to know about the outcomes by attempting the exam. Now, Mr. Arslan put his all the efforts from 0 to 5 to bring down his anxiety from 10 to 5. without knowing the passing level, and after attempting the exams the passing level was at 7. Now you know what just happened. Mr. Arslan is certain for the next time that he has already achieved level 5. He just needs to move 2 levels up. However, for the next time he would set his anxiety level at 14 instead of at 10. That's why at second attempt we are always more anxious. This is called cycle of constructive development, where anxiety plays a vital role to upgrade our skills. Now, what if Mr. Arslan don't attempt the exam? You know what is going to happen? His level of anxiety would suddenly fall all the way from level 10 to 0, where the work level is. This is short-term anxiety relief phase. Now, next time, instead of having that level 10 anxiety before 1 month of exam, Mr. Arslan would have persisted level 10 anxiety till 1 month before his next exam, and more than 10, or I can say level 20 till his exams. Because by avoiding his fear, he only achieved this level 10 anxiety, what his brain knows, and he need more than level 10 anxiety for the last month of exams, what he thinks. This is called cycle of anxiety or cycle of avoidance. This is also called cycle of destructive developmental skills. Now, if this level of anxiety or length of anxiety is too much, it would bring about anxiety disorders such as generalized anxiety disorder, where the length of anxiety persists for more than 6 months. Panic attacks or disorders, and phobia attacks, where even think of a trigger can bring about anxiety. Person continues to associate trigger with anxiety and never learns that trigger need not always result in fear, or that anxiety will naturally improve with prolonged exposure to an objectively neutral stressor. Now, the last question. Stress, fear and anxiety all are same thing in psychology. Take care of yourself. Goodbye. Allah Hafiz.